this. We've got a really interesting stack of sources for this deep dive, pulling insights from a recent session at the World Tamil Economic Conference.
Yeah, it's quite a mix.
The topic is vast. The future landscape of healthcare, the role of traditional medicine, and, well, the business opportunities hiding within these fields.
And what's great about these sources is they bring together three really distinct viewpoints from that session. So first, we get the perspective of a former health minister.
Right. Focused on policy, technology, public health.
Exactly. Then there's a specialist in Indian medicine making a strong case for the value and, the recognition of traditional practices.
Okay.
And finally, a medical equipment exporter laying out the global business opportunities in the sector. Quite practical.
Right. So our mission here is to dive into these different angles presented in the source material, pull out the most important nuggets, and see what they reveal when you look at them together. What does technology mean for tradition?
How does policy shape business? Things like that.
Exactly. It's about finding those intersections and understanding the dynamics at play.
Yeah, trying to connect the dots based on what was said.
And what does this all mean for you, the listener? Well, whether you're exploring potential investments, trying to get a handle on major healthcare trends, or maybe you just have a deep curiosity about how global health is being shaped by everything from AI to, well, ancient practices.
Then this should give you a good overview.
Yeah, this deep dive is designed to give you a clear, digestible overview based on what our sources say. Let's jump in.
Okay, let's start with the first perspective then. The former Minister of Health from Malaysia. His background is pretty extensive, which definitely informed his views in the sources.
Yeah, tell us about that. Not just a former minister.
No. He's also a dermatologist, was a senior leadership fellow at Harvard School of Public Health after COVID, and now advises the World Health Organization. So a really broad view.
Wow, okay. That's quite the CV. And the sources say his big focus was technology's impact.
Absolutely. One of the biggest takeaways from his perspective is how technology is just fundamentally reshaping healthcare, and at an incredible speed. He really zeroed in on the transformation of medical data management.
Ah, the old paper files versus digital. I remember seeing those huge rooms packed with folders.
Exactly. The source highlights the complete contrast now. He mentioned Malaysia's move toward something called the My Health Data Warehouse.
Okay.
And this isn't just about saving paper. It's about creating these massive digital reservoirs of health data.
So what does that actually let you do?
Well, that's the key. It enables incredibly detailed analysis. You can slice the data by ethnicity, age, lifestyle, you name it.
Ah, I see.
So you can start to understand diseases like diabetes in a totally new way, and even begin to predict which treatments might work best for specific groups. It just opens up entirely new possibilities for research, for targeted interventions, stuff that wasn't really possible before.
Right. And besides data, the sources mentioned information accessibility, the internet effect.
Huge point. On one hand, amazing opportunity, right?
Yeah.
Everyone can potentially be more informed about their health, find information instantly.
But there's always a but.
Well, the challenge the minister pointed out is that not all that information is accurate, or it's taken out of context.
So patients show up having already diagnosed themselves on WebMD.
Pretty much.
Yeah.
Or self-treated based on, questionable online sources.
Yeah.
And that creates this whole new dynamic for doctors.
How so?
They have to spend time navigating this information patients bring in, correcting misconceptions, managing expectations. The source implies that doctors who don't adapt to this new reality of informed or sometimes misinformed patients, they risk being left behind.
Makes sense. And what about professional interaction, how doctors learn?
Connectivity's changed that too. It's global and continuous now. The shift to virtual conferences, which COVID obviously accelerated, means experts can share knowledge instantly. The source even mentioned the minister giving a Harvard lecture from Malaysia. And doctors can learn new treatments through online webinars or even just watching procedures on YouTube from anywhere.
That's a massive shift from just attending a conference once a year.
Totally. And then think about personal health monitoring. Smartwatches, tracking sleep, continuous glucose monitors, all those health apps.
Yeah, my watch tells me everything.
Exactly. And this gives doctors access to a wealth of long-term, continuous patient data, stuff they never got in a typical 15-minute consultation.
So instead of a snapshot, they get the whole movie.
Precisely. They see trends. It allows for much, much better assessment when you finally do have that consultation.
Okay, and virtual consultations themselves.
They became essential during COVID, didn't they? Showed it was possible to deliver care remotely,
Yeah.
ensuring people still got help, even locked down.
Yeah, definitely proved the concept. What about electronic medical records, EMRs?
Another huge step, moving all that patient history out of physical storage into easily searchable digital systems. Huge benefits for accessing history quickly.
But it's not perfect, is it? The sources mention challenges.
Oh, definitely. The sources were quite realistic, integrating different EMR systems across hospitals, across regions. That remains a significant global hurdle.
Like the UK's NHS example mentioned.
Exactly. Despite massive investment, getting that seamless nationwide integration where everything talks to everything else, it's incredibly difficult. Requires immense effort, immense resources.
And AI. Did he touch on artificial intelligence?
He did, briefly, using his own field, dermatology as an example. He talked about how AI could potentially analyze, say, photos of skin conditions along with patient symptoms.
And suggest diagnoses.
Suggest diagnosis, yeah, or even predict treatment outcomes. The idea isn't necessarily replacing doctors, but more about giving them powerful tools to augment their abilities, assist them.
Okay, so a really technology-driven view of the future there.
Fundamentally, yes. From national data strategy right down to the consultation room and the patient's wrist. But he also, interestingly, briefly mentioned the growing interest in integrating traditional medicine.
Which leads us perfectly into the next perspective presented in the sources.
Exactly.
Okay, so after hearing about all that accelerating tech, the sources pivot. They bring in a specialist in Indian medicine. This feels like a very different angle.
It is. And the sources highlight a key development first. This Memorandum of Understanding, an MOU, on traditional medicine signed between Malaysia and India.
And that actually happened when the previous speaker, the minister, was in charge.
That's right. And the specialist emphasized that this MOU wasn't just symbolic. It led to real action, like Malaysia implementing a Traditional and Complementary Medicine Act.
Why is that act so important?
Because, as the specialist explained, it helps regulate the various traditional practices, including Indian medicine. It helps ensure practitioners actually have genuine qualifications.
So it addresses concerns about unqualified people practicing.
Exactly. It's about legitimacy and safety.
Got it. The sources also mention educational opportunities.
Yeah, stemming from this relationship, India, through the ICCR, that's the Indian Council for Cultural Relations, offers scholarships for Malaysians to study Indian medicine in India.
Oh, interesting.
And the source mentioned a point of pride that 4 Malaysian women have actually qualified as Ayurvedic doctors through this very scheme.
That's great. But the speaker also talked about challenges, right, in perception.
Very directly, yes. There's often this outdated image people might have of traditional Indian medicine practitioners.
Like what?
Well, the sources mentioned expectations of traditional attire, maybe a beard, things that might not reflect a modern practitioner, but can still be a barrier to acceptance for some people.
Stereotypes. And then there was this whole debate around evidence.
Yes, this was a really interesting point in the sources. The specialist introduced this idea of practice-based evidence.
Okay, how is that different from evidence-based medicine?
Well, the argument presented was that traditional medicine has proven its value through long-term practice over generations, essentially saying, look, it's worked for centuries, that's our evidence.
Contrasting with the constant testing and proof required in modern science.
Right. It's a different way of thinking about validation. The source connected this to the COVID experience, actually.
How so?
Mentioning Kabasura Kudanir, an Indian medicine preparation. Apparently, it gained a lot of public attention and provided comfort to many during the pandemic.
So it brought traditional practices back into the spotlight.
For a lot of people, yes.
Yeah.
But just like with online info for modern medicine, the information challenge exists here too.
Meaning?
The sources cautioned against what was termed WhatsApp YouTube University for traditional remedies, people self-medicating based on unreliable info, which again underlines the need for properly qualified practitioners.
Makes sense. Don't try this at home without expert advice.
Pretty much. And one of the most, let's say, forceful arguments the specialist made in the sources was challenging the narrative around side effects.
How did they challenge it? Usually that's a big concern with traditional remedies.
Their point was that modern Western medicine also has significant, sometimes serious, side effects. They listed examples. It's like paracetamol and potential liver damage in excess, metformin affecting B12 levels, statins causing muscle pain for some, even steroids used during COVID being linked to new diabetes cases.
Okay.
So the argument was, it's unfair to only scrutinize traditional medicine on side effects while often overlooking the known risks of modern drugs. The call was really to change that mindset and seek out qualified Indian medicine doctors.
So, questioning the double standard. And there was a practical issue, too, about registering products.
Yes, in Malaysia specifically.
Uh-oh.
The sources highlighted that it's really difficult to get a traditional product approved and marketed as a medicine for a specific disease, say diabetes,
Why is that?
because it requires that extensive modern scientific evidence base. It's apparently much easier to register and market it as a tonic or a supplement, which faces fewer regulatory hurdles and questions.
Interesting distinction. And finally, medical tourism.
Yeah, the potential there was mentioned. India, particularly Tamil Nadu, was highlighted as a leading destination for traditional treatments. And the sources noted efforts are underway to develop similar high-quality services in Malaysia, maybe to capture some of that market.
Okay, so a strong case for tradition, acknowledging challenges, but really pushing for recognition and integration.
Definitely. A call to look beyond just the modern paradigm.
Right. So we've heard about rapid tech advancement. We've heard about the push for traditional practices. Now, let's shift gears completely and look at this whole landscape from a purely business angle.
Okay, and this perspective comes from a medical equipment exporter based in New York, as presented in the sources.
And how did they frame it?
Very simply, healthcare is a fundamentally recession-proof market, one with seemingly unlimited opportunities. That's a very different lens, isn't it?
Yeah, very bottom line focused. What specific opportunities did the sources mention?
A whole range.
Yeah.
Starting with pharmaceuticals and their raw materials, where India is noted as a major player already.
Okay, makes sense. What else?
Disposables. Think gloves, gauze, syringes, all those basic consumables. It's a massive global market.
Dominated by China, usually.
Mostly, yeah. But the sources pointed out that post-COVID sentiment, especially in places like the U.S., has created opportunities. There's a push for supply chain diversification.
So an opening for manufacturers from other countries, like India?
Exactly.
Yeah.
To supply markets not just in the U.S., but also potentially Africa, South America, places looking for alternatives or additional suppliers.
Speaking of Africa, hospital construction there was mentioned as a big one.
Huge. Described in the sources as a virgin territory, desperately needing healthcare infrastructure. And the key point emphasized was that Indian companies can potentially build these facilities at a fraction of the cost compared to others.
Was there an example of that cost difference?
Yeah, pretty stark one. The sources gave a specific quote for radiotherapy equipment needed in Zimbabwe. A Malaysian company apparently quoted between $2–3 million.
Okay.
While an Indian company quoted $1.2 million.
Wow, that's a massive difference. That really illustrates the cost competitiveness.
It does. And beyond just building hospitals, the sources also mentioned opportunities in actually managing specific departments within them.
Like what kind of departments?
Things like radiology, providing the MRI, ultrasound, X-ray equipment, and maybe running the service. Or laboratory services, supplying equipment, reagents, and managing it, often on a profit-sharing basis with the hospital.
So providing specialized services within the larger structure. Interesting. What else?
An idea called reverse health tourism was mentioned.
Reverse, so not patients traveling to India.
Right, the opposite. Sending specialized Indian doctors or entire healthcare teams abroad for temporary surgical stints or consultations in countries that lack that specific expertise.
Ah, taking the expertise to the patient's country. Clever.
Then there's caregivers. This was highlighted as a really significant global demand area.
Because of aging populations.
Exactly. The U.S., U.K., Canada, Australia, Japan, all mentioned specifically in the sources. The opportunity identified is in training individuals, perhaps even those with just basic high school education.
Training them in what?
Fundamental care skills, taking blood pressure, temperature, assisting patients with mobility, basic hygiene, and crucially, combining that with language and cultural training tailored to the destination country.
And the sources suggested this could lead to setting up actual training schools.
Yeah, potential for a whole training infrastructure around this need.
Okay. What about shifts in the traditional medical tourism market?
The sources noted an interesting trend. Countries that used to send lots of patients abroad, like those in the Middle East or Bangladesh, are now developing their own high-quality facilities.
So less travel for standard treatments.
Seems likely, yeah. But interestingly, the demand from the Middle East for traditional or Indian medicine treatments apparently remains strong. So it's a niche within that market that's still robust.
Got it. Any other areas?
Yes, a few more crucial ones mentioned. Infectious waste management.
Ah, something often overlooked but vital.
Absolutely. Hospitals produced tons of hazardous waste. There's a critical need for properly regulated systems for collecting it, treating it through incineration or disinfection, and then safe disposal, or even reuse.
Reuse?
Yeah, the sources mentioned the problem of waste dumping and specifically highlighted the opportunity to treat and potentially reuse plastics from medical waste rather than having them sit in landfills forever.
That's a big environmental point, too.
Definitely. Then, biomedical services, just the basic, essential maintenance and repair of all that complex medical equipment. The sources noted Indian engineers are quite capable here.
Yep.
And a very specific service. Uniform services for hospitals, specialized cleaning and disinfection to prevent cross-contamination because often staff just wash them at home, which isn't ideal.
Huh, never thought of that one.
Me neither. Also, home health care is a growing trend globally. Patients increasingly prefer care at home, creating opportunities for businesses providing those services.
Right, and
Robotics are expanding too, used for tasks like medication delivery within hospitals, or maybe assisting in doctors' offices, welcoming patients, collecting basic info or vitals. The opportunity noted is in developing the software applications for these robots.
Making the robots useful for specific tasks.
Exactly. And finally, a huge one, nurses. Significant global demand, especially pointed out in the U.S.
Demand for nurses from India specifically.
Yes, the sources mentioned a specific push to increase H-1B visas for Indian nurses. So a major opportunity in nurse training and facilitating overseas placement.
Wow, okay. That's an incredibly broad range of business opportunities identified in the sources.
Absolutely. From raw materials to high-tech equipment, complex services, basic caregiving, waste management. It really covers the whole ecosystem.
So we've really spanned the gamut here based on these sources, haven't we? We've gone from the high-level policy and technology driving modern healthcare
The minister's perspective.
to the efforts to validate and integrate ancient traditional practices.
The Indian medicine specialist view.
And then landed on this very pragmatic, extensive list of global business opportunities in equipment, services, and human resources.
Yeah, and it's clear these different perspectives aren't really separate silos, are they? The sources kind of show us a healthcare world where tech might enable new ways to study, maybe even integrate traditional medicine.
Right, and where policy decisions clearly impact things like educational opportunities for traditional practitioners.
And global business flows seem to follow both the demand for the latest high-tech equipment and the demand for traditional treatments from specific regions. It's all interconnected.
And the sources did hint at that ongoing challenge, didn't they? About integration, despite some moves like having traditional medicine units in Malaysian hospitals.
Right.
Getting that full, large-scale, evidence-backed integration accepted by the mainstream medical community. That's still a work in progress, according to the sources.
Very much so. And the sources suggested that generating more rigorous evidence, particularly maybe from India itself, is seen as key to wider international adoption and acceptance.
So if we try and tie all these threads together, this breakneck pace of tech change, the renewed focus on tradition, the global business dynamics, it paints a picture of a healthcare landscape that's incredibly complex.
And evolving really, really rapidly.
So what does this all mean for you, the listener?
Well, it seems the health sector is just fertile ground for understanding these huge global trends, policy impacts, business ventures. It's way more than just the doctor's office.
Yeah, you really have to look at the whole picture. Considering the rise of AI, all the data flooding in from personal devices, this real push to integrate ancient practices alongside modern medicine, plus the potential for remote care, specialized service businesses.
It really makes you wonder, doesn't it?
It does, and maybe this is the thought to leave you with. In this increasingly technological, data-driven, and potentially integrated future of healthcare that the sources describe, what happens to that fundamental human element? Specifically, what is the evolving role of the doctor, the human connection, in the midst of all this change?